Gentlelady is recognized.
Thank you, Mr. Speaker. 33 days ago, funding for the Children's Health Insurance Program, which 9 million children rely on for their health care and well-being, expired after the program was allowed to lapse. States crafted budgets assuming federal CHIP funding would arrive on time, as it has always done. They're now scrambling to develop a patchwork solution to keep the program alive. 6 states in the District of Columbia have warned they will run out of funding by December next month. 13 states say they will soon have to tell enrollees they could lose coverage without immediate congressional action. Utah officials have even considered sending letters to enrollees as early as this week, letting them know the program is being forced to wind down. The Kaiser Family Foundation has found that 32 states are expected to run out of funding by March if Congress fails to act. So I'm glad we're here today with a bill to reauthorize CHIP and other public health programs, but they are woefully inadequate. This bill is paid for by eviscerating funding from one of the most important parts, again, of the Affordable Care Act that helps to keep people well, the Prevention Fund. This fund focuses on children's health, expanding access to life-saving vaccines and reducing the risk of lead poisoning, among many other things. This is a particularly heartless cut when you consider that many residents of Flint, Michigan, still can't get a clean glass of water from the faucet or bathe in uncontaminated water 3 years after the water crisis began. Children there in Flint will be forced to live for the rest of their lives with impacts ranging from neurodevelopmental damage and behavioral changes to hypertension and anemia, damage caused by a government that failed to act. If it fails to adequately fund Medicaid for Puerto Rico and the U.S. Virgin Islands, as they continue to try to rebuild following the devastating recent hurricanes, that would be a compounding of the tragedy. This bill fails to waive the requirement that both of those islands match federal investment before they can access any of the Medicaid funding. And we don't deal with that at all, even for CHIP. 70% of Puerto Rico doesn't even have power 6 weeks after Hurricane Maria hit. I'm proud to say that a lot of New York utility workers are down there now, and I'm sure we'll see results soon. Residents in Puerto Rico are washing clothes and bathing in contaminated streams and rivers and drinking it as well. 1 million people there still don't have any running water. They don't have the ability to put up millions of dollars either to match these funds because they are struggling to survive. And we don't address that. These are American citizens, and we have an obligation to help them. These reauthorizations are a chance to really work together and deliver, but we are worried about this opportunity because there is no indication this bill could pass the Senate with the cuts that is made to the Affordable Care Act. And I'm referring, of course, to the ones that to preventive care. That would be a major tragedy. As I've already said, so many states are right at the edge of not being able to fund the program at all. Other states are ready to tell both community health services and CHIP that they are no longer providing for them. So this partisan approach will only delay the extension of the programs even further. And I consider that a major, really derogation of our duties. And I reserve the balance of my time.